Africa continues to have the highest estimated proportions of unsafe abortions in the world because of mainly legal restrictions, but also stigma. More than 3/4 of abortions are unsafe, and they are done by untrained people using unrecommended methods. Sub-Saharan Africa also has the highest rate of abortion-related deaths in the world. About 30,000 or 60% of total abortion deaths are in South.
And it's a significant, obviously, it's a significant problem as well, and challenges and democracies around the world have been debating this topic. But Dr. Amisa, for your personal journey as well, you started as a physician holding anti-abortion views. What changed?
Well, it was an experience with a 14-year-old girl who came to my surgery asking for the termination of her pregnancy. To my eternal shame, I turned her away, and she died 2 days later in the hands of a abortionist. And from then on, I decided that I would find out what the abortion law in my country says. And I found that she could have been saved because she had been, as a 14-year-old, she had been statutory raped, and the laws allowed for safe abortion for cases of rape.
So what prevents safe abortions as well? I mean, is it also the social taboo, especially the cases that you mentioned? I mean, it's horrific, but it's the social taboo that prevents women from seeking help.
Yes, indeed. Disability.
And from this award that you have now won, what kind of message are you sending to those people to change things even more?
Yes, we have worked with the authorities at the African Union level, at the regional level in Africa, and at country level. And I hope that this award would further strengthen their hand in moving forward very quickly, because women are dying every day, to respect the laws that are available on this continent and in our countries. The African region has, the African Union has one of the laws that explicitly allows abortion for certain indications. And of all the conventions in the world, we have the Women's Protocol, or the Maputo Protocol. And I would urge that countries go ahead to work on this protocol and make services available to women to stop the unacceptable deaths in the region, because nobody needs to die from an unsafe abortion when we have the facilities to prevent that and the knowledge to prevent that.
Absolutely, and the access as well. But Dr. Eunice Brookman Amisa, thank you for joining us. Congratulations again on your award. And tomorrow we'll be speaking to another winner of the Right Livelihood Award, the Kenyan environmentalist Phyllis Umido, known as Mama Moshi. Stay with us.
Now, trainee surgeons here in the United Kingdom have started working with artificial intelligence to hope to understand better how to perform brain surgery. It's hoped the new technology being developed at University College London could be used by surgeons during live surgery within 2 years, making brain surgery safer and more effective. New technology has been given a cash boost from the government as part of a multi-million-pound grant to universities to help revolutionise AI healthcare in the UK. The government says this type of AI tool has the potential to be a real game changer for healthcare. The BBC's Global Health correspondent, Tulip Mazumdar, has been given access to the new technology.
In a darkened room, a latex face peeps through blue surgical drapes. All focus is on the nose as the endoscope, a long, thin tube with a small camera inside, is pushed up the left nostril towards the centre of the brain.
What are those structures here based on the AI? Can you see? Yeah.
Nicola Newell is one of the first trainee surgeons to use artificial intelligence to learn how to do keyhole brain surgery. Today she's trying to remove a tumour from the grape-sized pituitary gland.
We have a simulated pituitary operation here. The first screen is a camera footage from the little endoscope, and it's displaying the inside of this patient's brain.
That's consultant neurosurgeon Hanny Marcus, who's overseeing teaching today and is leading this AI project.
And on the other screen, adjacent to it, we have the AI, which is analysing this video in real time and identifying not just the tumour, but also the surrounding structures.
So what I'm looking at here is it's inside the brain. There's lots of different areas that are lit up different colours. So the middle is blue, you've got sort of pink. And that's the AI identifying that. What's it telling you?
Yes, that's right. So the blue right in the centre is the tumour itself. The structures around it are generally things you're trying to avoid. At the very bottom there in purple are the blood vessels that supply your brain. And injuring those blood vessels can result in a patient dying. And the AI, we know now from some studies, it does a very good job at defining this boundary, and surgeons like myself, even if you're very experienced, with the help of AI, do a better job defining that boundary than without AI.
This AI system has learned from watching and analysing more than 200 videos of this type of surgery. It would take your average brain surgeon around 10 years to gain that level of experience, but it's taken this system around 10 months.
Could in a few years have an AI system that has seen more operations than any human has ever or could ever see.
We've just come into the lab, which is next door to the mock theatre, and this is where two of the researchers who are teaching the AI about brain surgery are doing some of their work.
Should we have a look at the tumour resection space? Yeah, so let's go to the AI lab today.
One of them is Danielle Khan, who's a neurosurgery trainee and AI researcher. How do you make sure what you're teaching the AI is absolutely correct, that it's not going to sort of run away with itself with information that is possibly incomplete?
The type of AI we use is called supervised learning. Everything that we put into it is something that we've taken a look at as an entire team of experts. That looks like myself and some of the other members of our team spending hundreds of hours making sure that the information we're feeding the AI is as accurate as it can be.
Like the technology itself, regulation around artificial intelligence in healthcare is still evolving. Researchers here at UCL say they are working to develop national guidance and have very robust systems in place for their own work. They're also in touch with doctors in lower and middle income countries to see how this tech could be used elsewhere.
I think it's going to be huge, and I think it's going to be creating a whole different set of specialists for us.
That's consultant neurosurgeon Mahmoud Qureshi in Nairobi. He chairs the Neurological Society of Kenya and says he's excited by the new tech, but emphasises that it would need to be implemented very carefully.
We would want that technology to be promoted, but also to be evaluated in a collaborative fashion. We can adapt it to our needs. When you get that compilation through AI of a large number of surgeries done efficiently, and you learn from it, the trainees are going to pick this up much more quicker, turning them into better surgeons, reducing the morbidity and mortality of our patients in I believe, a significant way if we use it correctly.
That's the consultant neurosurgeon Mahmoud Qureshi, ending that report by our global health correspondent Tulip Mazumda. Now, Isaac Fanders, Golden Sports.
Yeah, we're going to talk about a big story in Serie A. The Napoli striker Victor Osimhen is reserving the right to take legal action against his own club after they posted a video on TikTok seemingly mocking the player. That's according to Osimhen's agent. The video has been deleted and it featured a clip of the striker's penalty miss from their 0-0 draw with Bologna on Sunday, with an odd sped up voice dubbing over the top, mocking the Nigerian. Let's get more on this from Italy. Vincenzo Credendino joins me on the line. Vincenzo, Osimhen led Napoli to that title, the first Scudetto in almost 30 years. It's not exactly the best way to endear a player to a club, is it?
Good morning to everybody. Victor Osimhen led Napoli to Scudetto today